Okay guys, this is part one of the kinesiology 2035 video. Today we're palpating the knee joint. We're going to start with the bony structures. So we have our lateral and our medial femoral condyles. We have our medial side, our lateral side. And then the femoral condyles are going to be right around there on the edges. And then your lateral and medial femoral epicondyles, you're going to go to the condyles and then you're just going to go back and up a little bit more, and you should be able to feel them on both sides as well. For the trochlear groove, it's going to be right underneath the patella, right about there. The lateral and medial tibial condyles, medial, lateral, and you're going to find your tibia, and you're just going to go out and up from the tibia, and they're right there. Next is the MCL and the LCL. The MCL is going to come down on this side, and then the LCL is going to come down on this side. And then for Gertie's tubercle, you're going to go onto the lateral side, and there should be a little indent right about there. It's almost next to the patella, but down a little bit, if that makes sense. Next is the tibial tuberosity. You can just go right underneath the patella and feel it, and you'll feel it protruding. It's very prominent. Next is the patella. Go ahead and put your leg down for me. The patella is just their kneecap, which is going to be right there. You should be able to feel all the way around it. Next is the patellar tendon. You're going to go to the patella, and you're going to go underneath the patella, and that's the patellar tendon. It's like in there. And then the patellar pulls, you have your superior and your inferior patella pulls. Just find your patella and then just go like that. Good as I like it, a little too much. Oh. Sorry about that. Anyways, the next part is the pes anserius, which is going to be on the medial side, right about here. And then next is the head of the fibula. You're going to go onto your lateral side again, and you can feel it right about there. And if you follow it all the way down, that's your fibula, and you should be able to feel it on your like on your ankle right here. That's where it ends. And then your tibia is your most prominent one that goes all the way down, where your tibial tuberosity is, all the way down to your foot as well. Next is the muscles. Next, we're doing the muscles for the palpation video. First up, we have rectus femoris. That is going to be the main thigh muscle right there, right in the middle. And its main action is hip flexion and knee extension. Next is vastus medialis and vastus lateralis. Vastus medialis is on the inside, vastus lateralis is on the outside. They both help with knee extension, and then vastus lateralis helps with stabilization. And then vastus intermedius, which is underneath rectus femoris, and that helps with knee extension. Can you go ahead and turn around for me? I'm going to go ahead and show you guys biceps femoris, which is going to be right there in the middle of the back of her thigh, right there. And then that aids in knee flexion, hip extension, and lateral rotation of the tibia. Next is semimembranosus, semitendinosus. Semimembranosus and semitendinosus are both right there. And those both help with knee flexion and hip extension. Go ahead and sit down for me. Next is the gracilis and sartorius. Gracilis is down here, and the gracilis helps with hip adduction and knee flexion, and then sartorius is going to be above the gracilis, and that helps with hip flexion and abduction. And then you have your popliteus, which is going to be underneath the knee, laterally, right there, and that just helps unlock the knee. And then lastly, but certainly not least, is your gastrocnemius, which is going to be your main calf muscle, and that helps with plantar flexion of the ankle and knee flexion. Thank you guys so much for watching.